When I was in my 20s and my brother had an accident and became a paraplegic, I thought I knew everything about having a person with a disability in the family. But it wasn't me that knew everything, it was my mother. She was his primary carer. And I realised when my son was born, I knew nothing. But now I've been on a 35-year learning curve and I know a lot more.
I'm a support worker for Zach, and I'm with Zach on Thursday and Friday. Zach has a boundless enthusiasm. It makes you want to come to work in the morning, you know. It's always fun to hang out with Zach.
Yes, Andy and I have been together for almost 20 years now, and the whole process of MS and a progressive disease has meant that the hospital system is a major part of our care reality.
I came from adventure tourism background. I was bringing people from Sydney to Byron, backpackers, teaching them to surf, living the carefree lifestyle until I got hit with a numbness to my left side, which resulted in an MS diagnosis.
Yes, well, we had an admission a couple of years ago that was less than favourable. It was in the local health district. My son was admitted with multiple seizures. In emergency, as always, they were professional in their dealings with my son. It was when we got to the ward that the experience became less than positive. Nursing staff were not really equipped to understand how to care for a person with multiple disabilities and complex care needs.
Often people with complex care needs have a poor experience in our health system, and that mostly comes down to poor communication and understanding. A lot of our staff haven't had any experience with people with a disability until they worked in health, so it can be a bit daunting talking to someone with a disability. Health staff need to remember it's okay not to know everything. It's okay to ask. Ask the best person in the room, the client first and then their carer. They are an expert on that person.
In terms of care for me, Kath, my wife, is quintessential. She does everything.
When a clinician or health practitioner doesn't actually see Andy, it's really quite obvious when you're relating to them. So we might be in the space side by side and they're relaying all the information directly to me instead of Andy. So I just simply turn my head and place the intention back to Andy. But it's really important to actually communicate directly to the participant you're talking about. And then if it includes me as a care, then you can relate to me. But that's one thing as a care support and a primary carer and a wife, is that I want him to be seen, because until he's got his voice or has a voice removed, it's important for him to be able to speak for himself, and that's what I advocate for all the time.
I think the things that we can improve in the health system when dealing with people with a disability is education first. Staff need to have education and be interested in doing education on learning how to best provide care. We want to be providing reasonable adjustments, which means that we're removing those barriers that someone with a disability might have, so that they have the same access to healthcare as every other person in our community. People with a disability are people first. They have the same wants, needs and healthcare issues as every other person we're going to look after.
When it came to that particular ED, I've been transferred from one ED where it had been established that I wasn't a cantankerous cripple, to an ambulance where I was left ramped for a couple of hours, and then to arrive in a very busy ED afterwards. There was no one there to communicate that, oh, this is Andy. He's actually cognitively one of us, for want of a better word, and can talk and advocate for himself. I was treated as somebody who was non-communicative, and that's why I was left in a bed while more urgent things were treated to. Yeah, it's a very disempowering place to be.
The experience that we have had with the hospital system is, particularly in the community nursing and doctors, they're ready to be curious and learn themselves and help us to support Andy's care needs to maintain independence away from health.
I think it's important to remember when we're talking about healthcare with people with a disability is that the needs are exactly the same as everybody else. We need to remember that people with a disability want the same things, need the same things and expect the same care as everybody else in our community.
Well, first and foremost, I would like a clinician to inquire of my son if he would be happy with the clinician to talk to me. Then I would advise a clinician that the most important thing that they can do is to listen to me because of my long experience in caring for my son and what the type of care that we expect for him and the respect that we expect for my son and myself.
I think it's really important when we're talking about people with a disability is that the things that we do to remove those barriers, those reasonable adjustments that we provide, will actually make our job a lot easier. It's going to make it easier for the client and easier for us. It doesn't take a lot of time to make a big impact on someone's health.
The care team at the hospital, being the nurses and the clinicians, need to get my care needs understood, and that's where Kath or whatever carer is with me is truly important. So
caring for my son, and I'm sure other mothers would say this, is never a burden. Sometimes it's a little bit difficult, but most of the time it's great. I wouldn't be without him for anything.
I think the most important thing that health staff need to remember is that people with a disability are people first. And if we approach the situation like that, we're going to have much better outcomes.